And welcome back. We're going to start the morning off with a conversation with Dr. Edwards Green, who is the UN Secretary General, Special Envoy for HIV in the Caribbean. We have the powerful Bishop Papouloute of the Belize Council of Churches. And we are graced as well with Miss Laura Longsworth in another hat. And she is here as the chairperson of the National AIDS Commission. Good morning.
Good morning. It's a pleasure to be here, especially for me, being flanked by these two esteemed men of the cloth, men of the world.
Yes, and such an important topic as well. Yes. And I want to start off taking the opportunity, since we have Dr. Green here, to talk about just a bit of the work that you do as Special Envoy for HIV in the Caribbean, and just to paint the picture as to what the reality is today.
Sure. Well, first of all, let me say that my tenure as UN Special Envoy just ended, and I'm the Special Advisor to UN AIDS and to the Pan-Caribbean Partnership Against AIDS. So I continue the work that I've been doing for the last 7 years, which is to interact with the major stakeholders globally and to try and advance what is called the UN high-level meeting political declaration, the new one of 2016, which really aims at fast-tracking the response to AIDS. Because we're at a stage now where, unlike when I first became the envoy, we could look forward to ending AIDS. And now the slogan is ending AIDS, fast-tracking to end AIDS by 2030. Because according to the science, if we could get 90 persons living with AIDS, 90% of the people living with AIDS on tested, 90% of those tested on treatment, and then 90% of those on treatment with suppressed viral load, we could really end this AIDS epidemic. Wow. So the science is showing that, and we are involved in trying to promote that among the various groups. One of the major target groups that we are focusing on are the key populations. And the key populations are not only LGBTI, they're the young women and young men, as well as those who are differently abled. And we're looking at the marginalized, people who can't have access to treatment. And therefore, how do we, and including the media, how do we use our platforms to get to them and involve them in the 90-90-90? So that's the trend.
Yeah. There was a time where, in Belize specifically, we can use our experience, we were bombarded by messages with about HIV, HIV prevention, and it was, I believe, a time where young girls were also most vulnerable to contracting the infection. But yet we've seen kind of a wax and wane of the new infection rates itself. And I believe it was in the past couple of years, you made a presentation speaking of the fact that we cannot lose sight of or focus on HIV because it is emerging, or we're beginning to see more new infections throughout the Caribbean. Talk to us about that.
Yes, well, this is one of the concerns that because I spoke of 90-90, and that gives us a good gauge. Yes. And I think Belize is among, and Mrs. Longsworth would be in a better position to give the figures, but they are among the countries that are doing fairly well on the testing. Okay. But most of the Caribbean countries are still having the problem where there is still a high rate of people not on treatment. Only 50% of those throughout the Caribbean with the HIV infections are on treatment. And so what we are seeing is that although we think we're making dents, the prevalence rates still remain very high. In for example, Jamaica, only 31% of those people with AIDS are on treatment. Wow. That is so low, it's preposterous. Do
they have access like we do in Belize?
They have access, but what has happened is you have a lot of the key populations that are not coming forward for treatment. Belize really is in a good position because I think, to the credit of the National AIDS Program, they have continued to do the advocacy. They have made the contact with the youth movements and with the faith leadership.
Yes.
I think that nexus is an important thing to get to the schools, to get to the marginalized communities, and to bring people into testing. I just want to make one more thing, is that although we could see that AIDS could be ended, people with AIDS will be dying of other diseases, the NCDs and so on. And therefore, really what the pattern is, as far as we are concerned from the UN and from PANCAP, is to treat the process going forward as an approach to integrated health. So that you're dealing with AIDS, you're looking at the lessons learned from AIDS, but you're also applying it to NCDs and other things.
I would love to hear I love Jamaica, but what are the numbers in Belize?
Okay, Belize, I think that Professor Green really set the stage, the regional stage. And let me say that even in Belize, or what we still consider, our rate is still considered high compared to the region. It's like 1.5, 1.7. We have a constant number of new cases since 2010. You know, when you look at the graph, before 2010, you had like 400 new cases per year, and since 2010, 2011, it's been a constant 200 new cases, 200, 225 cases. Last year was 225 new cases. Yeah. Now, what does that mean? That means that we have to really go back to the drawing board. If we have adopted to fast track the end of AIDS, we must do it for the health of our country and for our people, and we have to pay attention so that we create that environment, that enabling environment that will allow everyone to have access to testing, have access to treatment, and have access to the other kinds of care that they need, whether they have NCDs or other diseases. And one thing that we are particularly aware of is the vulnerability of those persons with HIV to TB. And so our the tuberculosis, our national strategic plan is really HIV TB. Yes. HIV TB, because every year you have a percent, most of those persons who are diagnosed with TB are HIV infected. And so you have, and TB, well, we know how communicable and how dangerous it can be to the health of our country. The National AIDS Commission welcomes the opportunity to have such an amazing conference of faith leaders in Belize. Yeah. And I really want to say that we at the National AIDS Commission treasure the presence of Canon Flowers, who has been on the commission even before it was a commission. And so he brings that, he keeps us grounded, and even when there's controversy in terms of discussions about our LGBT communities, when we speak about our young people and the whole issue of them not paying attention to the message, when we look at the trends in certain age groups, when you see the numbers going up with in our age groups between 35, 45 age range, where you see those numbers creeping up, then when you see the older population, some of you think that numbers increasing in the older you start saying, okay, now we need to, it's really important to have church at the table because of their congregation.
And that's my question. We're talking about sex for a lot of people in terms of the way they associate the word AIDS, association. But my thing is, how do you know what is the proper approach? I know when I first was exposed to the conversation about AIDS, it was about prevention, it was about condoms, and it was about, and then the conversation evolved to detection, get yourself tested. And then now it seems, just listening to the presentation this morning, that we are now on treatment and cure, well, to get rid of it. How do you know, and then also we're merging the churches into the conversation. At one point in time, it was the LGBTI population. What approach works? And we're saying that the current approach, we're not seeing changes, but there must be a focus. No matter what happens, there must be a focal point to your campaign. Otherwise, it won't be successful. How do you choose the effective focal point?
Because it's multi-sectorial, it's multifaceted, and you have to just, once you understand the profile, the disease profile, the cascade, you use a cascade and you use the social issues and you throw that in there and understand that the people that we serve, right? We have to understand the profile of the community. Yeah. The LGBT community, of course, they are particularly vulnerable because there are huge barriers to care in that community. But then when you look at in our community, we also, our young people are marginalized as well. Yeah. And because they don't have the kind of access to education. And there's a multi-cluster study that's available, and I looked at it yesterday. And there are quite a number of students who reported, and that is the study that's done by the Statistical Institute of Belize and UNICEF. Yeah. And they say, and the students are reporting, it's a low percentage of students who say that they have received information on HIV. So that's how we do it. Yeah. It's the entire profile, and so that's why we wanted our faith leaders on board. Yeah. And PANCAP, and Dr. Green represents PANCAP in this issue. PANCAP has been moving around promoting the Justice for All program, where we engage that group of people, our church leaders, our faith leaders, who may have or may not have difference in opinions. And I think that this is where we bring in Bishop Papouloute to talk a little bit about it. And Bishop Papouloute is very special. He puts us on his pulpit like we are preachers, and we allow us to speak. So
and I think that this is perhaps what piques my interest the most. Yes. When we talk about HIV, you know, Kevin says it's about sex, but I'm thinking more the vulnerable populations. And the vulnerable populations that we talk about, there might be young girls who would, if you use the church terminologies, would be engaging in fornication. We talk about the MSM population, which is men who have sex with men. And that means they're not necessarily gay or identify as gay. Sure. They may just have sex with men outside their marriage or in a homosexual relationship. Sure. We also see in Belize, which we really don't talk about enough, people who call themselves gay for pay, which is a form of commercial sex work, which means they engage in activities that they don't necessarily identify as a part of their sexuality.
It's an economic issue,
I use all of these examples just to say that these are extremely sensitive topics for the church, I would imagine. Yes. And being a part of a process where these are identified areas that need attention, how do you balance the religious beliefs and morals of those in your congregation and that you preach with the reality of what's happening on the ground?
Well, as sensitive as these issues may be, and they are, we cannot lose sight of the fact that those who are affected are part of the society in which we live, and to a great extent part of the church too. And if they are not part of the church in a worshiping way, they are part of the community in which they are relating to our children or to other people of our families. And so we cannot lose sight of the fact that as much as we feel that these people are on the other side, yet in practice, they are right here with us. Yes. And so the church has no choice but to, as sensitive these can be, to address them. And if we were to use the example of the gospel, indeed and in fact, Jesus himself addressed these very sensitive issues. He didn't run away from them. In a practical way, he sat with the people, he ministered to them, he taught them, and I think that's where the role of the church comes into play. Yeah. If it is the teaching through Bible study, through reflection and meditation, and invite people who know the subject to engage the congregation in a manner that the information can be passed on to all those who need to read. The church has no obligation but to do it, because at the end of the day, it creates more problem for us if we don't challenge it from the onset.
I imagine it'd be a bit of a symbiotic relationship as well, because where the AIDS Commission and the organizations that are working in this field benefit from having a further reach through the churches, it also allows, or I would imagine it allows, to tackle one of the main criticisms of the major religious groups across the globe, which is sometimes that they're out of touch with the major issues. How much do you feel that being a part of the National AIDS Commission as the Council of Churches has helped to give you better insight as to what the reality of behaviors and actions and thoughts of the Belizean people, how has it benefited you in your own professional realm?
Very much so. Even in December of last year, Mrs. Longsworth was our guest speaker at the Ebenezer Methodist Church in relation on HIV/AIDS Lord's Day, because we observe that every day, every first Sunday of the month of December. And the information alone and the statistics, and when we sit down and listen to what is happening, it's so real that you cannot distance yourself from that. And having attended those 2 consultations with PANCAP, and even the one I did not attend after having read the information about it, it's an eye-opener, and that we cannot, as a church community, rely ourselves only on what Scripture says. It is our foundation, but we have to at least understand and listen as to what is happening on the other side by way of scientific discoveries and orientation and so on and so forth, as to how we address and tackle this issue, because it is affecting the boys and girls in our schools. When the father or the mother is in that condition, then he or she cannot attend to those children. So it's much more challenging for the teachers, for the manager, for the chaplain, and so on and so forth. So we have to be real in addressing these issues.
Bishop, please forgive me for breaking up the hugging party that's going on, but I have to ask. Jesus had some credibility, because when he spoke, he was not only talking to these marginalized population, he was healing them. The lepers I would associate with our modern day persons who are affected by HIV. But Jesus had credibility. And so when he spoke, people listened. If I were to be devil's advocate and say, listen, the church in Belize, as it stands right now, is probably at its lowest in terms of credibility. And taking on these issues, the church itself is divided. A simple thing like the manual that was dealt with in school, there's been a huge schism in the church. And outside of that, the general perception of the church is that it is not as credible as it is. Even if you don't accept that, surely the attendance in the churches are dismal. Why then would the AIDS Commission join in with probably one of the quietest or the least influential at this point in time stakeholders in the community?
We are not the least quietest, you know.
No, the most quiet, the least influential.
Quietest, And in fact, as you made reference to the gender policy, we have no doubt that there are still points of contention from some corners of the church. But in fact, in general, I believe that it was 2 years ago, the main organizations that regroups the different denominations and churches in the country did give our blessings to the gender policy. And of course, in giving our blessing, that doesn't mean that there may not be still point of concerns. But in general, I believe, as far as I am concerned, and we from the Belize Council of Churches concerned, the gender policy was a good instrument. It wasn't a perfect instrument, but it's a good instrument to start with in creating a way of addressing some of those concerns that we have been challenging this morning. About the credibility of the church, let's put it this way. In every institution,
in Belize,
across the world,
in
every institution, you will have groups or individuals that are challenging the church, and we're talking about the church now. But the church as an institution itself will forever be a moral voice, a prophetic voice, and a credible voice, because the church is not my church, is not somebody else's church, it's the church of Jesus Christ. Jesus is the head. And in your introduction to that part, you said Jesus is credible.
Yes, he is.
I would like to just forge the nexus that you were asking for. What is that link, and why it is we are dependent on faith leadership to help us to advance that? Now, I speak as the advisor, special advisor to PANCAP that has developed the Justice for All roadmap. And it's a roadmap which really is broad-based. It deals with how we establish family values and help those in need, how we create gender equality and reduce violence against women, how we increase access to medicines, how we deal with decriminalizing laws that discriminate against people living with AIDS and other marginalized groups. Now, that's I would say, the philosophy behind the thing. But really, what is the essence that we are driving at, and what is really the thing that we have to react to? Stigma and discrimination. And we believe that the faith leadership and the religious organizations are critical to unlocking that the widespread
in Belize,
in Belize and elsewhere. And what I think is important for you to know is that over the period of the last 2 years, we created a faith leaders network, regional faith leaders network. And on that network, faith leaders agreed to incorporate a representative of the LGBTI community on the steering committee. And that has fostered a new dialogue. And I think we are moving forward now. And hopefully the dialogue that we're having here in Belize with faith leaders would help us to see how, despite the division among the faith leading group, because they're not homogeneous, we can move forward with reducing the stigma and discrimination.
Do you appreciate, though, however, that stigma has to be messaging? It has to be a connection between the person who is trying to dispel the stigma and your target population.
Exactly.
And to be as dry as this, maybe Facebook would be more effective than having the church deal with this. Because look at it, the target groups, your young people, they're not going to church and have probably zero respect for institutions, including the church. The LGBT population, LGBTI population, they're not friendly with the church, as you call them, they're on the outside. You know, commercial sex workers, not necessarily going to church or working at that time.
Yes. Transgender.
Transgender, they're not. So getting the church faith leaders is probably something that would have worked in probably the 1950s or 60s. But probably now, could it not say that we're probably barking up the wrong tree?
No, because we are also including the faith leaders in that new response in which we are connecting. And PANCAP now has a nodal which connects with social media, including Facebook. So if you went, you will see the dialogue, and now we are including into that dialogue the role of the contribution of faith leaders to ending AIDS.
And then I think my brother is going to the extreme in understanding what is happening here in Belize presently. Even that discussion we are having now, perhaps 20 years ago, we were not going to have
not have happened.
No. So a lot have taken place in Bible study. You know, people are asking questions on these matters. And so the conversation is going on. And the places of worship are not only the places where the church meet the community. We have schools. All our children go to school, to high school, to primary school. The conversation begins there.
But that's not the church.
How come it's not the church?
The church is a building. Your congregation.
You have a wrong interpretation of the church.
It's where, no, but I want to say one thing, because I think the point that Kevin is making is important. It's one of the views that people have when they see representatives of particular churches coming forward and to put it very bluntly, promote discrimination because they're so staunchly against particular groups. And so my question really is, to follow up off Kevin's, as a council of churches, and I know there is a fraction that is not associated with the council of churches as well, how do you work together to get everybody else on board when perhaps you, Reverend Papouloute, and we know Canon Flowers, he comes here and speaks very bluntly, and individuals in other churches as well, the personalities involved in the churches who are more progressive. How do you work with the others to have them understand that collectively the messaging has to be the same? Because whether I see one rogue person who speaks terribly about any marginalized group, my assumption will be is that's all the churches, and that's how all the churches think.
Well, conversations such as we're going to have today is one of the ways we're doing it. And voices like Canon Leroy Flowers and others, that's the way we're going to do it. And in the Belize Council of Churches, I would say, even when individual church has their own understanding on certain issues, I will confess that when it comes to attending, caring to these issues that we're talking about, the whole ideas of care, compassion, and love, and respect, and service to the community are at the forefront of our discussion and the way we want to go.
Now, let's move the conversation forward, and I think that one of the things that has to be discussed is obviously looking at how the messaging has changed over time. Kevin was alluding to it, where we spoke of, what was the ABC in the beginning? Abstinence. What was the second? What was B? I can't even remember now.
Be faithful.
Be faithful.
And use a condom.
And use a condom, yes. And I find there's been a lot of money pumped into HIV education, awareness, prevention, and even treatment is costly as well.
Those funds are dwindling.
Yes. And because there was an image painted that we were doing better, and now with the red flag raised that it's not as good, things aren't as great as we think it is, what is the current messaging that we want to tell people? I recall being in school, and when they said ABC, they wanted to skip B and C and only stick with A, which was very impractical even 20 years ago.
And it is now.
So I wouldn't begin to imagine what you would choose your messaging to be at this point in time, especially given the changes in the sexual dynamics that people have, and the examples that I mentioned before, the MSM populations, the gay for pay, the commercial sex workers, and young people engaging in sex or age of sexual initiation is 14, 15?
15.
15 for girls and lower for boys. But you hit the nail on the head. And I think there are certain critical things ironies that we have to resolve. One is the messaging, as you say. The main message now is test, treat, and defeat. That is a message. You have to be aggressive with that. Test, treat, and defeat. And you're not telling them what to do about their sexual life. But what you're doing is also identifying an irony.
The risks.
Yes, those risks. And here is where I think we need the messaging and we need the schools and the churches to then deal with sexual education in a way that children already understand, and not to sweep it under the carpet. And thirdly, I think we are articulating within PANCAP to reduce the disharmony between the age of consent and the age of access of adolescents to sexual and reproductive health. Because there's 18 and 16, and we know what...
And we're signatories of the Convention on the Rights of the Child. And we are signatories of the Convention. So we are pushing those kinds of things, and we're also asking for more countries to consider decriminalizing same-sex relations in private. Now, yes, I know that you've done that. But and here is where you will see the divisions within the faith leaders, the religious organization. But I think we need to make provision for those discords. And as you say, to use other modalities for the conversation to involve other people.
Could you
go ahead.
Could you assist me, because I like to listen to things on the macro, and I know, being part of an NGO, the Human Rights Commission of Belize, that in the past, getting funding, the buzzword was HIV/AIDS. Any project that dealt with that would get funding for. the buzzword now seems to be
NCD.
climate resilience.
Yes.
And everything seems to be connected, even if you're building a street, to climate resilience. Is the funding, and we're depending,
Yes.
I heard
the funding is
Ms. Longsworth saying that...
We just completed a proposal to Global Fund.
Yes.
And we're getting 50% of what we would get.
So
that is there. What we work with in terms of our own country and other countries is working. We have to work to make sure that our government can assume the gaps.
Okay.
And so over the years we've been working, and our own government, for instance, we're among those countries, because there are some countries where people don't have access to ARVs.
Yes.
We do provide ARVs. Part of this initiative, for instance, is for us, to our faith leaders, to know that there's a stigma attached to even taking ARVs.
Yeah.
And because of that, only 50% of our HIV-infected persons remain on their ARVs. Those
The
are
antiretrovirals.
Antiretrovirals. Those are the things that control. The antiretrovirals control the viral suppression. And
How much of the virus you have in your body.
And then, of course,
Yeah.
it ends the transmission.
Yeah.
So when you talk about ending AIDS, that's what we're
Yeah.
talking about.
And I just
See?
wanted to say that the director of PANCAP, Mr. Springer, and myself, one of the parts of the mission is discussions with the Ministry of Finance and the Ministers of Finance. We will be meeting with them tomorrow, and we met with Ministers of Finance in Suriname, in Trinidad, in Guyana, and so on. And one of the things is to discuss how we can allocate the resources, even with resource constraints, so that we could use the funds available more efficiently, so that, for example, we treat AIDS as part of integrated health and ensure that there is access to services and so on. And this is what we are doing. And what we saw in Trinidad, in Jamaica 2 days ago, is that because they're at the IMF, they're in some serious problems. But they are able to look at the budget and to see where they can get the efficiencies. And you know what is the problem? Politically, the problem is the efficiency is the large staff in health, some of which have to be cut if you were to gain those efficiencies and use the technology. So you see the problem.
But we just had a nurse here who said that there's a shortage of nurses. We look at that carefully. We just completed that exercise. We have looked at our investment model. We have also looked at the investment from the government of Belize, and they have continued to invest quite a bit in putting in machines in the laboratory for testings, increasing the services at the various centers, and so on. They're fully on board because they are the providers, and so they pay attention, especially when it comes to us having to go after other funds to do the public relations, the public awareness campaigns, and so on.
I understand. When we talk about funding and there's a limitation, you know, changing behavior is one of those gargantuan tasks that people across the globe are trying to figure out how to. I mean, we hear about HIV, we know, well, maybe this population, because we heard it enough, maybe the younger ones aren't as exposed. We kind of have an idea of how to prevent it, but we're still not making the changes in the moment itself that we need to do. And that's really the question that I want to get at. In Belize, I'll speak for Belize's context, and while Kevin thinks people don't go to church, I can't tell you how many times an argument disintegrates to, well, Jesus says this or God says that. So we wear a cloak of morality, yet our behavior behind closed doors is not reflecting that. And my question is it perhaps that the funds that we've exhausted to this point not been as productive as we want it to be because we're still being too polite about the conversation? Sex is not taboo. People procreate. HIV is still a reality. Other issues that we know, HPV, for example, that people come in contact with, that may lead to cervical cancer. All these other issues are there. The health statistics are there. Teenage pregnancy, 1 in every 4 in this country. We know or we have an idea what's happening behind closed doors. Some physicians even think that our rise in colorectal cancer may be looking at some of the behaviors that people are having behind closed doors as well. So are we perhaps, have we wasted decades being polite about this conversation?
Possibly.
Because we want to pretend like people are not having sex, or they don't want to talk publicly about it and the risks associated?
Yes.
I think that I think you've hit the nail on the head. We need to remember, you said that you work on you're also a member of the Human Rights Commission
of Belize.
And we have Mr. Bradley, who is our vice chair.
President.
And so the whole issue of our human rights is at stake here. Because when you deny children the kind of education that they need, you're really impeding, you're denying them of their rights to information, that they can use and incorporate in their psyche to protect themselves.
And
I'm very worried, I'm very worried, just to close off the funding point, because I know how issues in Belize are driven. We're heavily dependent on international funding.
Yes.
The government is already stretched in terms of being able to give us the services, goods and services that we need locally. And so a lot of the issues which are driven and are successfully carried out, children, you have UNICEF, who is a huge partner. You have the Swiss, who are funding certain things. And I'm very concerned that there's a shift internationally away from the issue of HIV to another issue.
Yes.
And I don't know how well we locally can manage, depending on the government.
We have to manage it. We have to take it on, and we continue to work towards integration of HIV/AIDS into the wider system. There are some things that need to be done. For instance, how well do we as a government or as a Ministry of Health work with vulnerable populations? So you'll always have to have your social contracting, you'll have to have civil society on board to make sure that the community voice is heard. But the idea is for integration of services. So when you walk into a health center, you're assessed, whether it's for a pap smear or it's for an HIV test. It's offered to you. And what the work continues in terms of creating that environment of confidentiality within the work. It's very complex. Confidentiality within the workplace, services, so that you don't have a missed opportunity of providing counseling and care to either somebody that you perceive as being vulnerable for the very reason that they're there, or because you fail to refer that person and move on. Those are the challenges that the wider health system face. But apart from that, we can't continue to expect that we'll be funded internationally. We pray that it continues, because we don't have, monies are not available for the public campaign that you're missing. You don't see that bit of it. And so we have to push, we have to use all the parameters that we have. We have to make sure that our health and family life curriculum is relevant. Relevant. We have to make sure that our health professionals create that environment. And we monitor and we have to use wisely the resources that we have through the Ministry of Health for services.
I was just going to add that last 2 weeks when we were in Trinidad for that meeting,
multi-stakeholder meeting,
the faith leaders met in separate groups, and one of the things that we commit ourselves to is to be engaged in a much more practical way in the whole matter of the same questions you raised earlier about sex education in our schools, in our churches, wherever the church meets with people in the family, because we feel that that's very important if we're going to make some progress in addressing some of the social issues.
That must have been a very interesting
Yes.
conversation.
Yes,
Do you want to shed some more light on what the buy-in was from the different groups represented there in being able? I'm still stuck on the politeness because
Well,
I think,
perhaps
yeah.
Dr.
Yeah.
Green.
I think that it's important to note that that meeting was a regional meeting.
Yes.
And that we had representatives. Now, what is happening with meetings, the specific meetings in countries dealing with faith leaders network,
Yeah.
is now to have to drill down and have the national networks themselves debate and to decide on how they go forward. As I say, there will be divisions. But what is important about the meeting we had, which would influence how we deal with it in Belize, is that PANCAP has developed a youth advocacy group because following what you said, there's a recognition that the voices of youth are those voices that could affect the change that we want because they're connected with issues which we old people speak about them and which they have no clue about how we
And
could.
we have no clue what they're doing.
So on. So in fact, the advocacy group, youth advocacy group, decided that they would incorporate youth leaders in the countries, including CARICOM youth ambassadors, and you know that you lead in
We
that,
have our youth
plus
council here.
leaders of youth in key populations. And so they are meeting next month, and they will provide a strategy for public awareness, peer counseling, and so on, based on their views as what could change that dynamic and make a difference that you were asking.
Yes.
And that is where they will then roll that out and ask the faith leaders to incorporate it and to buy in and so on.
You know, don't get me wrong. I think that the church can possibly have a very important role in this conversation. But the church in Belize, in my opinion, is far from in a place of health. If an analogy was made there, in my mind, there are a lot of similarities between the HIV virus and the health of the church. Maybe the church has AIDS in terms of in terms of there's a challenge, and a lot of the issues that the church is having and are not able to resolve are because they don't speak about it, because they're too polite about it, because they're not honest about it. And people are watching it from the outside. So if you're talking to me in Belize, we're watching the coal in your eye, in my eye, and we're watching the lamppost in yours. And so it is an important conversation, because if the public would see the church in a place of health, then the church would have the ability and credibility to speak to it.
I think that's
Bishop,
So it's a good thing.
It's a pity we didn't think of it, because we have 2 keynote speakers.
Exactly. And you know, it's the voice of you see, the voice of youth. You see, that's important, and you know that is often missing from these conversations. Politeness, and we won't allow the young people in to let us.
I'm not young,
though. We're putting you in that youth frame, and so that is very important to hear from our young people and give them a voice. And we have some dynamic young people. When you speak to young people who identify as an LGBT or as being gay, and you hear what they have to say, that they go to church, they want to go to church, but they're afraid of being identified as such, because if it is, then they will be discriminated against and as an outcast and so on. These young people speak up. We just have to give them the forum.
And the consultation in Suriname speaks to that by making our places of worship spaces of hospitality. And they are already, you know, they are already. And I will not deny the fact that there are instances in which the churches respond to these situations, less a lot to be desired. And I will not deny the fact. But at the same time, our churches, our congregations, our pastors, a number of them are ready and willing to speak to these issues. And it's just to get ready to be engaged in the conversation.
Well, I think it's hopeful that you were here, that that the Council of Churches, in fact, has been a long-standing partner with the National AIDS Commission in this fight against HIV. Of course, I think just being able to point out where we see what may be viewed as hypocrisy when their stance is taken against progress in areas like health education, that they have to be pointed out. Because if you're going to be a partner, we must recognize the role in some of what may seem a separate topic, but really the foundation of being able to change behavior, which is the education of children with adequate reproductive health rights.
Yes.
Yeah.
May I ask you a question?
It usually goes the other way.
No.
Wrap it up now.
Yes.
It's okay.
Would it be possible for us to consider having a discussion with communication media experts in the round coming up?
Absolutely.
And to engage that and to have it not only located within Belize, but use the media in a regional sense to have that discussion in this frank way.
Actually, it would be a great public service.
I
Because
see why you're in that position.
You're good. He's good at what he does.
He's good.
And I just want to, I know you're looking to wrap up, but I really want to welcome the whole idea, Dr. Green. You do have a guest speaker,
yes,
Bishop Papouloute.
The conference takes place today.
Yes.
Let's talk a bit about what's happening.
The conference starts in the next half an hour, I believe,
Wow.
at the Radisson. And then our guest speaker for this morning will be
Jesus?
No, not Bishop Pereira from Guyana. He will be our keynote speaker for this morning. Of course, the chairperson of the National AIDS Commission will speak as well. The First Lady, Mrs. Kim Simplis-Bauer, will be there to share with us. Ministry of Health representative will be there to give us an update of what is taking place in relation to HIV/AIDS in Belize. And in the afternoon part, we'll have plenaries where we tackle some of the very issues that you have, working groups, where we tackle some of the very issues that
It's going to be good, man.
you're going to.
It's going to be good.
Best of luck, and we really hope for a productive day. We thank you for coming in and having this conversation publicly, because it's been happening in conferences, other places. And I think any progress made in building this relationship or strengthening this relationship can only help to move us towards the original point that you made, which is eventually bringing an end to this disease. Thank you so much for being here.
Thank you.
We're going to go ahead and take a break, and when we come back, it's time to cook with Chef Sean Quillen as we celebrate the launch of the Belican Chocolate Stout season. Stay tuned.